The healthcare reform or the healthcare system now?
Current healthcare system now. The weaknesses.
Well, the weakness is it costs too much and doesn't insure everyone, and we have uneven quality. The strength is that in certain areas we have the best quality in the world. It's a very dynamic part. We still provide excellent care and excellent training in various parts, but it's very uneven. That's a real problem.
Okay.
Everything will be improved by the new healthcare reform law. One, we'll have a structure finally where everyone can have insurance, and that's a big advantage. Second, we'll have a variety of ways of controlling costs and keeping the costs down. And third, we're going to improve the quality. We're going to reduce things like hospital-acquired infections, medication errors, but also improve the care for the people who use the system the most, the people with chronic illness. Because you can't save money unless you focus in on improving care for people who have chronic illness, whether it's heart disease or diabetes or emphysema from smoking or cancer. So that will be the places you'll see the biggest improvement. Well, we already fund insurance now. I mean, it's not. The challenge isn't how to fund it. The challenge is how to deliver good quality care with better financial incentives to keep the costs low. And that's, I mean, to fund a voucher, we already pay $2.8 trillion on healthcare. I mean, we've got a voucher. We've got more than enough money for a voucher system. That's not the issue. Funding is not the issue. The issue is how do you convert that funding into an efficient system. Actually, in healthcare reform, when we were negotiating the bill, the pharmaceutical industry was actually quite cooperative because they recognized by giving more people insurance, by giving more incentives to high-quality care, they were going to make more money. And so they were willing to be very cooperative in the healthcare reform. And in fact, they're paying a large amount of taxes in support of the bill. So this is a case where the pharmaceutical industry actually played ball pretty well. I'm not going to judge anyone, but the question is, do you have someone where you've really done the maximal therapies, say, and you can't control their pain? Right now I don't know those examples, but I think the real issue is whether you legalize it or whether you don't legalize it. And I think I've been very clear, consistent for many years, that I don't think legalization is the right answer. I don't think you want to make this easy. I do think you want to have many safeguards to allow people to get the optimal palliative care so that they actually are comfortable and not suffering. So if you take the case of organ transplantation, I think it's very important that we don't put the individual doctor on the hot seat. It's what we need to do is have a good discussion in society and good policies to address these issues. We cannot have a situation where society sort of pretends that we are not making these decisions. Every country, certainly in the case of liver transplantation, does not have enough livers and has to make allocation decisions. And I think that needs to be a society-wide proposal. And we've made arguments as to how we think those decisions can be made best and most optimally. So I don't think having an individual doctor having to make those decisions all the time is a good idea.